Hi everyone, welcome back to TSPN's News in Depth, and we're talking about Medicare Part D. And soon we're going to be having some clinics. And why don't we go ahead and put that graphic on the screen, and you can tell everybody about the clinics that are coming up.
Okay.
What are the dates for that?
The Medicare drop-in clinic for Amador County is November 14th from 9 a.m. to 2 p.m. And what that means is anybody who would like to come find out about their Medicare Part D, they can come in with their Medicare card and their prescriptions, and we will do an analysis for them. We'll assess their needs, and if they would like us to help them with the enrollment, we will.
Okay, and where's that going to be again?
That is going to be at the Amador Senior Center, and that is November 14th.
Okay, now they can also get a hold of you, I believe, to call to ask questions.
Yes, we also have our 800 number, 800-434-0222, that they can call for a one-on-one counseling.
Right.
We do one-on-one counseling also at the Amador Senior Center. They can call that 800 number and set up an appointment with a counselor.
Okay. All right, and we have another graphic. Alan, what's that other graphic? Can you put that up, please? Okay, so the open enrollment, we're giving the dates there.
Yes.
So once again, really important to keep that in mind for the open enrollment.
Yes, and I can tell you that in Amador, we're filling up very quickly.
Okay.
So to answer the other
So
question.
they will come back and put that phone number back up, and if they get a hold of you, and I'm sure they can get a hold
Yes.
of you, we can get an appointment.
Yes,
for 'em.
definitely.
And then that's easy. They meet at the senior center for that appointment.
And it's one-on-one with a counselor, and it's based on their personal needs.
And that's where you want them to bring their drugs and all of that, so
Yep. So
they're
it's
all
based on their needs.
they wind up being all squared away when they leave?
Yes, for the first of the year, yes, they are.
Okay, good. And that's coming up pretty fast. You'd be surprised how fast a month goes. In no time at all, we'll be there. We're already
Yes.
on I think we're already at the 17th, so in the 15th of next month, you can take advantage. Okay, now, there's probably a lot of questions. We're covering, Medicare, and California also has Cover California.
Yes.
They're not the two, but how are they compared, or what do we have? Compared's not the right word. This Cover California isn't for Medicare people.
Right. Covered California, if somebody has Medicare, they're in Medicare, they're accessing Medicare, they're going to be in Medicare as of the 1st of January 14, they do not need a policy from the Covered California Health Exchange. The Covered California Health Exchange is for those who have no insurance or are underinsured, and Medicare is considered your insurance, your primary insurance.
Okay. So, once again, Area 12 and HICAP under that is going to be able to help you up with the open enrollment. Now, tell us about, the drug plan once again.
In regards to how it works?
Yeah.
So Medicare Part D prescription drug programs, we don't know how many we're going to have next year, but how it is set up is that the drug plan, the insurance company signs a contract with Medicare, and then the insurance company goes out and barters for the individual drugs to be on that particular formulary, their formulary.
Now, during that year that a person's involved, if they see a doctor and they have more medications, they get it from that plan?
Yes, they do. And when we counsel the clients, we tell them, when you sign up for a plan, you get a formulary. Take that with you to the doctor. Take that formulary with you. The doctor can make sure that that drug is right there on the formulary, so you don't find out the hard way when you go to the pharmacy that it's not covered. Because if it's not covered, the doctor can start the first process of getting that drug for you by calling the pharmacy and say, hey, Mrs. Jane needs this drug. We need to put it on her formulary. He has to make that first phone call.
Okay.
So.
Are there any questions that you get that you might want to share with people ahead of time?
About
when people have their meetings?
Oh, we get many questions about what happens if my drugs change mid-year. Can the plan change on me mid-year? The plans can change, but they have to give you 60 days notice if they're dropping a drug, unless, of course, the FDA says that drug is no longer allowed to be sold. Then it can come off immediately. But they have to give 60 days notice, written notice, that a drug is going to be dropped from the formulary. That is a big question because people don't know what's going to happen to them mid-year, They want to know if they will have an ability. The other thing that HICAP can do is, let's say the plan didn't put it on the formulary form, we will access a database of pharmaceutical assistance plans to try to find coverage for that particular drug for that client, or many drugs.
Okay, so you're definitely the person to get a hold of, and HICAP, the group to get a hold of,
Yes.
because you are advocates for Medicare patients here
Medicare
in Amador
patients.
County.
Amador, Alpine, Calaveras, and Tuolumne.
Okay, so you have a big area.
And Mariposa, yes.
Okay.
Very large area.
All right, and that sounds pretty good. Now, you know, you were on the show. We had Today's Seniors Living Well, and it was kind of interesting. You told us that, Lori Webb, and you talked, and I imagine you talked about the same things, and you said that that video gets viewed quite a lot, and I was pretty surprised. Why don't you tell us the great story?
Well, somebody saw the video, and they sent it to the California State Department of Aging, and they sent it to D.C. because they just loved what we did. And it was actually not Lori's, it was your show.
Oh, okay. Well, okay.
Lori's is also, but the one that we did, they sent to D.C. It had to do with Medicare Part D last year, and they sent that to D.C.
Okay, I looked that up as well, hoping that I wouldn't fall in the same, holes that I did there as well. And of course, if you're first coming up on, Medicare, and Medicare it's
Confusing.
It's confusing, and it's basically, until you get there, you probably don't care much about it.
Right.
And then when you do get there, you get a lot of paperwork. Now, if it's your first year, you don't have any yet because, as Debbie was telling me earlier, they don't have any of the plans out yet. So probably just maybe a couple weeks, before maybe the end of this month, we'll start getting things in the mail
Exactly.
to make our new decisions with. And, maybe you feel like you can make the decision yourself, but there's quite a lot, and you're thumbing through the pages and moving to here and there. So if they could come and get dropped through your computer program, it'll
make it
help.
simple, yes. And there's so many choices and so many decisions, and I've had clients come in with graphs with all the plans listed, and we get it done in 10
and it
minutes.
can be very daunting because you don't feel like, well, this is going to be for my whole year, and I hope I get it right. And so it can create a lot of anxiety for people maybe the first time
Well, a lot of
around.
people think they're stuck in it for good. They don't realize that every year they can change, so we educate them on that also and show them their options.
Sometimes a year feels like it could be forever.
It can feel like forever,
Okay,
that's for sure.
and we want to give the number once again. That's 800-434-0222. Now, who's going to answer the phone?
Staff always answers the phone unless it's lunch hour, and then we have an answering service, or answering machine. But HICAP will make the appointment for you. Myself or my other two staff, Gina or Patty, will make the appointment for whatever county you're in with a counselor. HICAP is also a volunteer-based program, and so in all of our off-sites, even at the Area 12, it's volunteers that have been trained and gone through many years of training. Amador volunteers have been doing this for 15 and 17 years. They've been doing it longer than me. They're incredible counselors. All of them are.
Okay, and so let's go ahead and put that slide up there one more time for the first of all, what do we have, Alan, there for the open enrollment? So once again, that's going to be the 15th through December 7th, and you can give HICAP a call on there. And of course, tell them once again about the drop-in clinic.
The drop-in clinic is for anybody who would like to come in that didn't make an appointment, doesn't like to make appointments, and just wants to come in and get their Part D reassessed. We'll do it if it's their first time or the 10th time they've done it.
Okay, we have that's going to be, what's that date again?
November 14th from 9 a.m. to 2 at the Amador Senior Center.
All right, and once again, if you want to give a call, you're going to be, the staff's going to answer the phone. The phone number is 800-434-0222, and you can get all the help you need for your drug program.
Or all your Medicare
Part D,
needs.
or all of Medicare.
All
Medicare.
all your Medicare needs we can help you with.
All of your Medicare needs. What more could you want? Okay. Thank you very much, Debbie, for stopping by and being with us here today on TSPN. And we hope this gave you some information. And
Please
until
call.
next time, give them a call. Thank you. Bye-bye.
You're watching Amador County's #1 news and sports leader, TSPN.